Welcome back to Judgment Decision Making. I'm Dr. Padilla, and today we're going to talk about, should patients be forced to buy lottery tickets? If there's anything that every healthcare consumer in America is forced to buy, whether she wants to or not, it is the right to sue the doctor for negligence. It may seem strange to think that we purchase the right to sue, but of course, that right is not an itemized portion of our insurance bill, but it is certainly included in the price, unfortunately. One way to think about this is with the analogy of FedEx. What you can do with FedEx is you can pay more to ship more expensive goods. Essentially, the more the company would have to pay if it loses or drops a package, the more the company charges you up front, which is shown here in this insurance calculator based on the value of the package. And we're all very comfortable with that it should cost more to insure something that is more expensive and we pay for it up front. But if you're shipping something that you don't really care about, maybe it gets lost, maybe it's some small item like a hair product, and you don't really care if it gets lost, so you're willing to take that risk, you shouldn't have to pay as much as if you're shipping a diamond ring, for example, and you'd care very much if that particular item got lost or damaged. It might seem strange to think that we purchase the right to sue, but consider the fact that customers face higher prices simply because they retain the right to sue a business. For example, think about if you had the right to sue your professors. Imagine a scenario where you had the right to sue your professors if they taught you something that turned out to be wrong. How would you feel about that? Would you be interested in being in that situation? Now imagine how much more expensive your education would be today if universities and their employees had to carry malteaching insurance. If UC Merced had to insure everything that I said, you best believe that they would charge you much more for your education than they do now. But it is reasonable amount of risk to take on that you as a student take on when you come to my class, that maybe I tell you something that isn't exactly accurate, but it's not going to end the world. So in this case, it's a scenario where we might not necessarily need insurance, because if you get inaccurate information from me, it isn't like your health is going to be hindered in some way. And so there's a certain amount of trust that happens in that interaction. Not only would education be more expensive, but it would also be less effective because professors would be afraid to take risks for fear of being sued, which is absolutely right. You might have noticed in this class, I do lots of things like bring up modern topics, try to do interesting things with tutorials or demonstrations. And I would be more nervous about doing those things if I was nervous about being sued. So I do have some freedom to try to teach you in the way that is most effective and experiment in that process as well. Many universities and students would likely contract their way out of this agreement and have education without the right to sue for bad teaching. And I think that that is an important point that this book is trying to make, is that giving people the option to not sue, to waive their right to sue, could in some cases be good if the risk was minimal, as in the case with universities and suing your professor. Similarly, many patients and healthcare providers would gladly enter an arrangement to eliminate the right to sue for negligence for low-risk interactions. Some of those interactions I can think of are going to the doctor to get birth control. I think I would be willing to waive my right to sue to see my primary care provider and just get a prescription for birth control. I don't think there's a lot that would go wrong in that interaction, and I trust my primary care provider to prescribe me the right prescription. Another one are really simple procedures like removing warts. I'm sure many of you have had those types of procedures where you go in to get a checkup and they can remove a wart or do some type of procedure just right there on the spot. And it's very low risk of having any catastrophic harm associated with that procedure. Those are cases where some people, including myself, would be interested in waiving the right to sue in order to reduce the cost of those very low risk procedures. In return, a doctor, hospital, or insurance carrier would offer a patient a low price for healthcare. Some patients would choose to take the lower price and assume the risk themselves, as in the case with these low-risk medical procedures. Others would prefer to waive the medical malpractice liability and instead buy private disability or injury insurance. For most patients, these legal rulings might seem like a great protection. However, the book proposes is that it isn't always to your advantage to be forced to buy the right to sue. For example, imagine a scenario where people had the right to sue their hairdresser and that the cost of this insurance raised the price of a haircut by $50 after someone receives a hideous haircut with a settlement of $7 million. And the question here is, would you be interested in saving $50 per haircut to give up the right to sue if you got a bad one? Would you be angry if someone prevented you from having that right to sue? I want you to think about that now. Would you be interested in having a much cheaper haircut but giving up your right to sue? Now, this isn't a perfect comparison because haircuts, your hair grows back. It's not that big of a deal. But there definitely are some low-risk procedures that are more akin to this type of scenario. The issue here is that one study found that fewer of 2% of people who are injured by negligence in New York hospital over the course of a year actually filed a malpractice claim. So even though we're forced to purchase this insurance, only 2% of the people that actually could have benefited from it filed the claims. So it's really not helping the people that it was intended to protect because you still have to file a claim even though you're insured. And this brings up insurance fraud. Of the claims that were filed, expert reviewers found that there was no evidence of negligence or even injury in many of the suits that resulted in the payouts. One factor that influences patients' decisions to sue is when a doctor apologizes. If a doctor simply apologizes for a bad procedure, people are significantly less likely to sue. If an apology prevents a lawsuit, then the detriment effect of the right to sue is further reduced. So the book is proposing all of these circumstances where it isn't as if this malpractice claim is really motivating doctors to provide better health care because they can just apologize to people. And very few people actually make those types of claims. Okay, this is especially important for people without a lot of money, of course. Since it is impossible to buy medical treatment without implicitly buying the right to sue, sick people who can afford the treatment but not the package of treatment plus sue option will not get the treatment. So this is really excluding people who could potentially pay for a lower cost procedure, but they couldn't afford the additional insurance. Even more issues. So the jury awards in these malpractice proceedings are highly erratic and difficult to predict from the facts of the cases, which is a huge problem. You should be able to fairly directly predict the size of the payout based on the facts of the case. So patients are effectively forced to buy a kind of lottery ticket, one that might be worth anything from $1 million to nothing, but that is on average worth no more than 60 cents for the dollar spent, the rest going to lawyers. That's the real proposition of this chapter, is that because there's so much variability in those payouts, it's essentially like being forced to buy a lottery ticket, and there's no alternative options available to people currently. So should people be required to buy such a lottery ticket? According to the book, choice architects should be willing to recognize that many people would be better off if they were given the freedom to waive liability. And this is the proposition of the book. This is my personal belief. And I want you to think about if you agree with this or not. Choice architects should give serious consideration to allowing freedom to contract in the context of negligence in medical care. Okay, summary here. According to the book, health insurance companies should be permitted to offer plans with and without the right to sue for negligence. And again, according to the book, patients should be presumed to be permitted to sue only for intentional or reckless wrongdoing and not for mere negligence. And again, these are the propositions of the book, and I want you now to think about if you agree with these policies or not. What is good? What is bad? And how can we think about designing a choice architecture system that meets our moral and ethical guidelines?